Hello, everyone. We are a group of students representing both the Asian American Professional Student Association here on campus, as well as the Asian Pacific American Medical Student Association at the College of Medicine. And this past year, we were given the opportunity to collaborate with the OKC Asian Health Coalition here in the city to help run their annual Asian Health Fair. And so we decided to approach this with a more interprofessional take, and here are our findings.
I'd like to start off this presentation by discussing a few statistics about healthcare among Asian patients that I think are important to note. In the United States, prevalence of diabetes among Asian is 21%, which is double the prevalence in their white counterparts. Asian Americans are also the only racial and ethnic group for whom cancer is the leading cause of death in both men and women. This can come as a surprise to some people because if you look at aggregated data, Asian women have the breast cancer incidence rate that is significantly lower than their non-Hispanic white women. However, if you look at disaggregated data, and by that I mean data that's further stratified into Asian subgroups, incidence rate for breast cancer ranges from 36.9 to 126.5 per 100,000 women. This is a wide range, with the highest incidence rate overlapping, if not higher, compared to their white counterparts. This aggregated data also shows approximately 12.8 to 18.1 of women from each Asian subgroup received no follow-up 1 year after their initial appointment. Filipino women continue to have the highest mortality rate from breast cancer. And while the Asian Health Coalition and OKC Asian Health Fair have been contributing to the efforts of narrowing the gaps in healthcare disparity among the Oklahoma communities, the OKC Asian Health Fair is an annual health fair that was started back in 1993 by what we call the Asian Health Coalition. The Asian Health Coalition was founded by three co-founders, Dr. Tu, Mrs. Hugh, and Mrs. Green. These co-founders had the same vision for the Asian Health Coalition, which is to facilitate health management, provide resources and medical services, and promote preventative care and wellness to the ethnic minority communities, especially the Asian community in Oklahoma City, which at the time consisted of a lot of uninsured and low-income immigrants and refugees. So how are they going to do this? They established what we now know as the Asian Health Fair, which is held annually in the Asian district of Oklahoma City. The very first Asian Health Fair was back in 1993, and through the past 3 decades, the Asian Health Coalition have been able to provide free medical screenings, consultations, and referrals to specialists to approximately 22,600 uninsured and low-income patients from multiple backgrounds. And over the years, the Asian Health Fair has received support not only from local physicians, but also from local businesses and community leaders who have contributed to this health fair in many ways. Even with the Affordable Care Act and the recent Medicaid expansion in Oklahoma, there are still and expected to be more patients who continue to fall between the gaps, whether it's due to healthcare costs or accessibility. So we expect that the Asian Health Fair will remain crucial for addressing their needs.
Marketing for this event included flyers that provided a comprehensive summary of services we provided, ranging from vaccinations, point of care testing, and dental exams. Various languages, including Korean and Vietnamese, were offered to accommodate and reach a larger portion of the Asian community within Oklahoma City. This adaptation of these different languages demonstrates the importance of inclusion and involvement of all Asian backgrounds as we aim to serve our local community.
Here's the student volunteer workflow at the health fair. We had nursing, pharmacy, and physical training stations all in the same lobby to facilitate an interprofessional workflow. Nursing students took vitals and then sent the patient to pharmacy students who conducted a medication review and blood glucose testing. Patients that were noted to have diabetes by either known diagnosis or elevated glucose level were then sent to the medical students during the peripheral neuropathy screening, which is a complication of poorly controlled diabetes. Those without diabetes can proceed directly to the thyroid screening station. After finishing these core screenings, the patients were given the option to visit the dental and vision stations for further evaluation. Students from different colleges directly communicated with each other regarding patient care, facilitating interprofessional collaboration. Historically, the screening services was relatively limited, but this year, Because of the involvement of multiple colleges, we were able to expand our service to provide a more comprehensive health screening. Here are some of the highlights of the event. There were a variety of volunteers from students to faculty to alumni who are now providers. It's good to see so many people show up out of the goodness of their heart to give back to the community.
In Asian Health Fair, there were about 220 patients that were seen, with 55 students volunteering. These students were from 4 colleges of OU Health Science Center, including nursing, medicine, dental, and pharmacy, with 33 volunteers coming from College of Medicine, 8 from dentistry, 8 from nursing, and 6 from pharmacy. On this graph, we can see that cholesterol screening, blood pressure, glucose, and BMI screening were the popular services, with approximately 35 to 45 patients receiving these services. Each graph bar has color, and it represents different colleges that provided the services. IPEC competencies have been carried out at the fair. So as we can see, there are 4 main values and ethics, roles and responsibilities, interprofessional communication, teams, and teamwork. So all of these things have been carried out at the fair. As patients went through multiple health fair stations, it required that students from different colleges would listen and actively discuss mutual patient that they shared. And in the beginning of the health fair, we also had a collaborative huddle with different colleges to discuss our value as a team, also to kind of make sure we are on the same page about our distinct roles. At the end of health fair, we also gave one another instructive and sensitive feedback on how to improve the workflow and other additional services that we can provide in the future. These experiences meet all the competencies of IPC.
Ideas for future improvement. Starting with data tracking, we want to increase pre and post event surveys to better identify underserved and popular needs and to bring in services where those needs are being met. For the volunteers, we want to increase training so that volunteers have a better understanding of the workspace so that they can help guide patients who need help and have more easy accessibility to translators due to a common language barrier. And a shared space among all the students will allow for more collaboration to observe and learn from one another. For our workflow and facility, we want to prioritize large open spaces. This is mainly for our older population and for those with disabilities so that we can minimize stairs and walking distance. And we want to utilize maps and help stations so that patients can easily identify those who can help them and guide them to their next location. And on the outreach end, we want to cast a wider net by incorporating community hubs like religious institutions, local businesses, and PCPs that patients already use, so we can promote the event year-round and reach as many people as possible.
We now want to take a more proactive approach for the next Asian Health Fair. So first, forming an OU-HSC Health Fair Committee. This will allow streamlining all students from different colleges. Doing this will create an interprofessionalism environment for strategic planning as well, and will also improve or provide a learning environment at OU-HSC for students from different colleges to work with one another. Second is communication. We want to attend debrief meetings periodically with Dr. Trong and other committee members who are our leaders for the next Asian Health Fair. This will also provide student participation to include input on how to optimize patient care and efficiency. It is also a great opportunity to apply things we learn in school into practice. And last is implementation. We want to make sure and ensure our goals are met with considerations for improvements as mentioned before.
Last but certainly not least, we want to extend a thank you to all the Asian Health Fair sponsors on this slide. This event would not have been possible or as successful without each of their individual contributions. We'd also like to thank Karen Nguyen, second-year pharmacy student here on campus, for putting together our wonderful presentation. Thank you all for your time.